Yeah. Okay, as many of you know, this is Abby. She's our injector, and we're gonna do a couple things. We're just gonna do some touch up and just some fine tuning things. And one thing we like to do that's really changed our practice that Abby really likes is this removable skin marker, and it just allows us to be really precise with our injections. Obviously, you know, Abby doesn't need much. We're just gonna touch on very few areas, but now we can identify before we inject just some very fine areas. We've already marked out her glabella. We're actually just going to use 12 units here, just a very small amount in her forehead because she has a shorter forehead. And then we're going to equalize her cheekbones a little bit by just small micro doses here and on the side there. We use these special insulin syringes, and that allows us to be very precise. And as you can see, it's a fairly comfortable injection. And then we're just going to use a very small amount in her forehead, just 8 units. And one thing that's important is that we look very closely for tiny little veins. And she does have some of those, so we're going to do what we can to just stay away from those veins. It just allows us to avoid sometimes some small bruises that you can get. It also makes it more comfortable. Yeah, so we put 8 units just in her forehead. And then she has just slightly asymmetric cheeks, so we're going to build up her cheek in a couple different spots. We're working right in that fat pad that sits in her cheek. And just stepping back and really doing 3-dimensional sculpting. We're very careful to try and apply pressure right away after we inject. That really minimizes the chance of bleeding. And what we like to do is really show the patient as we're injecting so that they can participate and really make sure we're hitting the areas that they want us to hit. We always like to clean them off before showing them. And the hyaluronic acids can actually be molded, so you can inject and then actually smooth and mold a little bit. This special pen comes off very easily.
There's a big difference with the cheek.
Yeah. Open just about a centimeter. Here, your right side is more hollow than your. We're using Volbella here. It's very smooth. It feels very natural in the lips.
Very soft.
And our first step is just to get her more symmetrical. You can see now she's even, her right side is matching her left side, and then we can do what we want to sculpt. And we can put a little bit to build up what we call the lower tubercle of the lip. And the Volbella just glides and fills and hydrates the lips. Okay, put your lips together once. A drop here. That's it. And this can also be molded and smooth. Vobel is very soft, so it really distributes nicely, and you have to do less work with molding and massage. And lips are very important to have the patient keep looking and making sure that it's not overdone, that it's what they want. Yeah. I think that's pretty good.
Feels numb.
Yeah.